Have you noticed that your body doesn't respond the way it used to, even though your desire is still there? Many older men quietly experience this shift, and it can feel confusing, frustrating, and even discouraging. The truth is, changes in sexual performance are extremely common with age, and they are not a personal failure. They are often the result of normal changes in blood flow, muscle tone, and nerve sensitivity that happen over time. As men get older, circulation naturally slows. Blood vessels become less flexible. Muscles that once worked automatically can weaken if they are not used or supported. This includes a group of muscles most men never think about, yet they play a key role in sexual function. When these muscles and the surrounding nerves are not functioning at their best, firmness and control can decline. This is not about desire. It is about communication between the brain, nerves, muscles, and blood vessels. Here is the important part many men are never told. Supporting sexual function does not always start with medication or extreme solutions. In men's health research, there is strong evidence that certain muscles and nerve pathways respond to gentle stimulation and improved awareness. When these areas are activated correctly, they can support better circulation and muscle coordination. This does not mean instant results. It means creating the right conditions for your body to work more efficiently. Today's video focuses on one specific spot that is deeply connected to male pelvic health. This area has been studied in pelvic floor therapy and rehabilitation for decades. It is known to influence muscle engagement and nerve signaling that are involved in erection quality and control. Gentle massage of this spot is sometimes used alongside pelvic floor training to help men reconnect with muscles that may have become weak or inactive over time. It is important to be clear and honest from the start. This is not a magic trick. It is not a cure for every cause of erectile dysfunction. Conditions like advanced diabetes, severe heart disease, or major nerve damage require medical care. But for many older men with mild to moderate changes related to aging, circulation, or muscle weakness, supporting pelvic health can make a meaningful difference over time. What makes this approach powerful is its simplicity. It does not rely on force. It does not overstimulate. It works by encouraging relaxation, awareness, and gentle activation of muscles that support blood flow to the pelvic region. Research consistently shows that when pelvic floor muscles function better, sexual performance often improves as a result. Massage alone is not a treatment, but it can be a helpful tool when used correctly and safely. In this video, you will learn exactly where this spot is, why it matters, and how a brief, gentle 1-minute technique can support your body instead of stressing it. You will also learn what realistic results look like and how to avoid common mistakes that can make things worse instead of better. If you stay until the end, you will also understand how this simple habit fits into a bigger picture of male health, including movement, breathing, and daily choices that protect circulation and nerve function as you age. This knowledge gives you control, clarity, and confidence, not false hope, but real understanding. Now that you understand why age-related changes happen and why gentle support matters, it's time to explain exactly what this spot is and why it has such a strong connection to male sexual function. This area is not mysterious or hidden in alternative medicine. It is well documented in anatomy, rehabilitation science, and men's pelvic health research. Yet most men are never taught about it. The spot being discussed is called the perineum. It is the soft area located between the scrotum and the anus. This region may seem insignificant on the surface, but beneath it lies a complex network of muscles, connective tissue, blood vessels, and nerves that play a direct role in erection quality and ejaculatory control. This area forms the base of the pelvic floor, a group of muscles that support the bladder, bowel, and sexual organs. One of the key muscles connected to this region is responsible for helping trap blood inside the penis during an erection. When this muscle contracts properly, it supports firmness by slowing the outflow of blood. When it becomes weak, tense, or poorly coordinated, erections may feel softer or harder to maintain. This is not a theory. Multiple clinical studies have shown that men with stronger and better controlled pelvic floor muscles often experience improved erectile function. This area is also closely linked to an important nerve pathway known as the pudendal nerve. This nerve carries signals between the brain and the pelvic region, including sensation and muscle activation. With aging, prolonged sitting, stress, or lack of muscle engagement, this nerve can become irritated or less responsive. Gentle pressure and relaxation around the perineum may help reduce unnecessary tension and increase awareness of this nerve pathway. This does not mean forcing stimulation. It means creating a calm signal environment so the body can respond more naturally. Blood flow is another critical factor. Erections are fundamentally a vascular process. Healthy blood flow into the penile tissue is required for firmness. The perineal region sits near arteries and veins that serve the pelvic organs. While massage does not directly open blood vessels, gentle pressure combined with relaxation can support circulation by reducing muscle tightness that may compress surrounding tissues. This is one reason pelvic floor therapy often includes manual techniques as part of a broader rehabilitation approach. It is important to understand what this massage does not do. It does not increase testosterone. It does not override severe arterial disease. It does not replace medical evaluation when symptoms are persistent or worsening. What it can do is help restore communication between muscles and nerves that may have become underactive or overly tense with age. For many men, especially those with mild to moderate changes, this reconnection can support better control and responsiveness over time. Research into pelvic floor training has consistently shown that awareness is just as important as strength. Many men unknowingly hold chronic tension in the pelvic area due to stress, posture, or habit. This tension can interfere with normal muscle contraction patterns. Gentle massage of the perineum encourages relaxation first. Relaxation allows proper activation to follow. This sequence is essential. Muscles that cannot relax properly cannot contract efficiently. Another reason this area matters is its role in coordination. Sexual function is not just about one muscle or one vessel. It is about timing. Muscles must engage at the right moment, nerves must transmit signals clearly, and blood must flow freely. Supporting the perineal area helps improve this coordination. This is why pelvic floor rehabilitation is used not only for erectile changes, but also for urinary control and pelvic discomfort in men. The idea of using gentle touch to support muscle and nerve health is well established in physical therapy. It is not aggressive. It is not painful. In fact, pain is a signal to stop. The goal is awareness, comfort, and consistency. 1 minute is often enough to stimulate awareness without causing irritation. Longer or harder pressure does not produce better results and can actually increase tension. By understanding the anatomy and the science behind this spot, you move away from guesswork and toward informed action. You are no longer relying on hype or exaggerated claims. You are working with your body instead of fighting it. This approach respects the natural changes that come with age while still supporting function and confidence. In the final section, safe use, expectations, and long-term support, understanding why this area matters naturally leads to how gentle massage actually works inside the body. This is where many misunderstandings exist, so clarity is essential. The purpose of this technique is not stimulation in the sexual sense. It is functional support. It works by influencing 3 systems that must work together for healthy sexual response: muscles, nerves, and blood flow. When gentle pressure is applied to the perineal area, the first response happens in the muscles. Many men carry unconscious tension in the pelvic floor. This tension can be caused by stress, prolonged sitting, poor posture, or simply aging. Tight muscles do not function well. They restrict movement, reduce coordination, and interfere with blood circulation. Gentle massage encourages these muscles to relax. Relaxation is not weakness. It is a necessary first step for proper strength and control. Once tension begins to release, muscle awareness improves. Awareness means the brain can better sense what the muscles are doing. Research in rehabilitation science shows that improved awareness often leads to better voluntary control. This matters because pelvic floor muscles play an active role during erection. They help support firmness by contributing to pressure regulation within the penis. Muscles that are relaxed and responsive can engage when needed and release when appropriate. The second system involved is the nervous system. Nerves respond best in a calm environment. Chronic tension, anxiety, or irritation can disrupt clear signaling. Gentle massage around the perineum can help calm the surrounding tissues, reducing unnecessary stimulation that may interfere with nerve function. This does not mean nerves are being activated in a dramatic way. It means they are being allowed to function without constant background noise from tight muscles or restricted tissues. Slow breathing during this process further supports nerve regulation. Deep, steady breathing signals the nervous system that the body is safe. This shifts the body away from a stress response and toward a restorative state. Sexual function depends heavily on this balance. When the body is in a constant state of stress, blood vessels constrict and muscle coordination suffers. Calm breathing combined with gentle touch supports the opposite response. The third system involved is circulation. Erections depend on healthy blood inflow and controlled blood outflow. While massage does not directly change the structure of blood vessels, it can influence circulation indirectly. Tight muscles can compress nearby vessels, limiting efficient blood movement. By reducing muscle tension and improving tissue mobility, gentle massage may help create a more favorable environment for blood flow in the pelvic region. It is important to keep expectations realistic. This technique does not produce instant or dramatic changes after a single attempt. The body adapts gradually. Studies on pelvic floor rehabilitation consistently show that improvements occur over weeks, not minutes. The value of a 1-minute massage lies in consistency and correctness, not intensity. Over time, repeated gentle stimulation helps reinforce awareness and relaxation patterns that support better function. Pressure should always be light to moderate. Pain is not productive. Pain causes protective muscle tightening, which works against the goal. The sensation should feel neutral or mildly soothing. If discomfort occurs, pressure should be reduced or stopped. This approach respects the body's natural responses instead of forcing change. Another important factor is posture and positioning. The pelvic floor does not work in isolation. It is influenced by the hips, lower back, and abdomen. Sitting or standing in a relaxed, supported position helps the muscles respond more effectively. Slouching or straining can increase tension and reduce the benefit of the technique. Small adjustments in posture can make a meaningful difference. This method works best when combined with patience and a broader view of health. Hydration, regular movement, and cardiovascular health all influence circulation and nerve function. Gentle daily walking, stretching, and avoiding prolonged sitting support the same systems involved in sexual response. The massage is one tool, not the entire solution. What makes this approach valuable is that it encourages men to reconnect with their bodies in a calm, informed way. It replaces anxiety with understanding. It replaces force with cooperation. Many men report that simply feeling more aware and relaxed in the pelvic area improves confidence, which itself plays a role in performance. Confidence reduces stress, and reduced stress supports better physiological response. This is not about chasing youth. It is about supporting function with respect for how the body changes over time. Small, consistent actions can help maintain capability and comfort well into later years. When done correctly, this technique is safe, simple, and aligned with what is already known about pelvic health. Safe use, expectations, and long-term support. At this point, it's important to ground everything you've learned in what research actually shows, because trust is built on clarity, not exaggeration. Pelvic health has been studied for decades, and male sexual function is no longer treated as a mystery or a taboo topic in science. What consistently appears in credible studies is that erectile function depends on the combined performance of blood vessels, nerves, and pelvic floor muscles. When one of these systems underperforms, overall function can decline, even if desire remains strong. Clinical research on pelvic floor rehabilitation in men has shown measurable improvements in erectile firmness and control, especially in men with mild to moderate dysfunction. These improvements are most often seen when pelvic floor awareness and coordination are improved over time. This does not mean every man experiences the same result. It means that for a significant portion of men, addressing muscle function leads to meaningful change. Massage of the perineal area is not studied as a standalone cure, but it is commonly used as a supportive technique within broader pelvic health programs. One reason this approach works for some men is that aging often affects muscle timing before it affects muscle strength. A muscle may still be capable of contracting, but it may not activate at the right moment or relax fully when needed. Research in neuromuscular control shows that gentle sensory input can help restore proper timing. Massage provides that input by increasing awareness without overwhelming the nervous system. This is why gentleness matters more than pressure. Blood vessel health is another key factor supported by evidence. Erections rely on healthy endothelial function, which allows blood vessels to expand and fill efficiently. While massage does not reverse vascular disease, reducing pelvic muscle tension can support better local circulation. Studies consistently show that reduced muscular compression improves blood flow efficiency in surrounding tissues. This effect is subtle but meaningful when practiced consistently. It is also important to address expectations honestly. Pelvic support techniques are most effective for men whose erectile changes are related to aging, reduced activity, mild circulation issues, or pelvic muscle dysfunction. Men with advanced diabetes, severe cardiovascular disease, or significant nerve damage may experience limited benefit from massage alone. In these cases, pelvic techniques may still support comfort and awareness, but they should not be viewed as a replacement for comprehensive medical care. Another area supported by research is the relationship between anxiety and sexual performance. Stress activates the sympathetic nervous system, which constricts blood vessels and increases muscle tension. This response directly interferes with erection quality. Techniques that encourage relaxation, slow breathing, and body awareness help shift the nervous system toward a calmer state. Studies on stress reduction consistently show improvements in sexual response when anxiety is reduced. Massage supports this process by encouraging a state of calm rather than urgency. Consistency is a recurring theme in every credible study. Occasional effort produces minimal change. Repeated, gentle practice allows the nervous system and muscles to adapt. This is why short daily practices are often more effective than intense, irregular attempts. 1 minute practiced with attention and relaxation can be more beneficial than longer sessions performed with tension or impatience. It is also worth noting that pelvic health is closely linked to overall physical activity. Research shows that men who engage in regular walking, light strength training, or mobility exercises tend to have better erectile function than sedentary men. Movement improves circulation, insulin sensitivity, and nerve health. Massage complements movement by addressing localized tension that movement alone may not resolve. Hydration and sleep also play a role. Dehydration can affect blood volume and circulation. Poor sleep disrupts hormone balance and increases stress hormones that interfere with sexual response. Supporting pelvic health works best when basic lifestyle factors are addressed alongside it. This does not require perfection. Small improvements compound over time. What separates evidence-based advice from misinformation is respect for limits. No credible research claims that a single technique works for everyone. What research does support is that informed, gentle, and consistent practices can support function and quality of life. This approach empowers men to participate actively in their own health rather than relying solely on external solutions. The most important takeaway from the research is that male sexual health is adaptable. Aging does not mean automatic loss. It means change, and change can be supported. When muscles are guided instead of forced, when nerves are calmed instead of overstimulated, and when circulation is supported instead of stressed, the body often responds positively. Safe use, expectations, and long-term support. Everything discussed so far works best when it is applied with care, patience, and respect for how the body adapts over time. This is where safe use and realistic expectations become essential. Gentle perineal massage is meant to support natural function, not force results. The body responds to consistency, not urgency. When practiced calmly, this technique fits naturally into daily self-care without creating pressure or stress. The first principle is gentleness. The tissues in the pelvic area are sensitive and richly supplied with nerves. Excessive pressure can cause irritation, inflammation, or protective muscle tightening, which works against the intended effect. The sensation should never be sharp or painful. A mild feeling of pressure or warmth is enough. If discomfort appears, easing off or stopping altogether is the correct response. The body communicates clearly when it needs less, not more. Duration also matters. Short, focused practice is supported by rehabilitation research. 1 minute is sufficient to encourage awareness and relaxation without overstimulation. Longer sessions do not speed up progress and may increase sensitivity or tension. What matters most is regularity. Daily or near daily practice allows the nervous system to recognize this input as safe and familiar, which supports gradual adaptation. Breathing should remain slow and natural throughout. Holding the breath or straining creates internal pressure that increases pelvic tension. Deep, relaxed breathing supports parasympathetic nervous system activity, which is associated with improved blood flow and muscle coordination. This state is essential for healthy sexual response. Calm breathing also reduces performance anxiety, which is a common but often overlooked contributor to erectile difficulty. It is equally important to know when this technique should be paused or avoided. Any active infection, open skin irritation, recent pelvic surgery, or unexplained pelvic pain should be evaluated before applying pressure in this area. Persistent erectile dysfunction, especially when accompanied by pain, numbness, or sudden onset, should not be self-managed alone. These symptoms can signal underlying conditions that require proper assessment. Progress should be measured realistically. Improvement may show up as better awareness, reduced tension, improved comfort, or more consistent response rather than dramatic changes overnight. Some men notice gradual improvements in firmness or endurance over several weeks. Others notice improved confidence and reduced anxiety, which indirectly supports performance. These outcomes are meaningful and supported by what is known about mind-body interaction in sexual health. This practice is most effective when combined with habits that support circulation and nerve health. Regular movement encourages blood flow throughout the body, including the pelvic region. Walking, light resistance exercise, and gentle stretching all support vascular function. Prolonged sitting without breaks can increase pelvic tension and reduce circulation, so changing position regularly matters. Sleep quality also plays a role. Poor sleep increases stress hormones and disrupts normal hormonal rhythms that support sexual function. Adequate rest supports recovery, nerve signaling, and vascular health. Hydration supports blood volume and tissue elasticity. These factors may seem basic, but research consistently shows they influence erectile function. Nutrition contributes as well. Diets that support cardiovascular health also support sexual health. Adequate intake of fruits, vegetables, healthy fats, and whole foods supports endothelial function, which is essential for proper blood vessel response. This technique works best when the body's foundational systems are supported rather than strained. The most sustainable benefit of this approach is that it encourages long-term awareness instead of short-term fixes. Men who understand how their pelvic muscles feel at rest and during engagement are better able to notice changes early and respond appropriately. This awareness supports autonomy and confidence, which are central to healthy aging. Aging does not eliminate the body's ability to adapt. It changes the pace at which adaptation happens. Gentle, informed practices respect that pace. When expectations are aligned with physiology, frustration decreases and consistency becomes easier. This is how small daily actions build meaningful support over time. Safe use, expectations, and long-term support. When everything is brought together, the value of this approach becomes clearer. It is not built on secrecy or shortcuts. It is built on understanding how the body maintains function and how small, consistent actions can support that process. Sexual health does not exist in isolation. It reflects the condition of blood vessels, nerves, muscles, and the nervous system as a whole. Supporting one area gently can influence the entire system when done correctly. One of the most overlooked benefits of this practice is that it restores a sense of connection. Many men experience sexual changes as something that happens to them, outside of their control. That feeling alone can increase stress, which further interferes with performance. Learning to work with the body instead of against it changes that dynamic. It shifts the focus from outcome to process. This shift is supported by behavioral and physiological research, showing that reduced performance pressure improves sexual response. Consistency remains the most important factor. The body learns through repetition. When gentle perineal massage is practiced regularly, the nervous system becomes familiar with the sensation and no longer treats it as a threat. Muscles begin to relax more easily. Awareness improves. This creates a foundation that supports better coordination during arousal. Progress may feel subtle at first, but subtle changes often signal that the body is adapting in a healthy way. It is also helpful to remember that sexual response varies from day to day. Sleep quality, stress levels, hydration, and emotional state all influence performance. Expecting the same response every time is unrealistic and can lead to unnecessary frustration. A supportive practice like this helps smooth out fluctuations over time rather than eliminate them completely. That stability is what many men notice first.